you've got things like this instrument here, this probe, and these forceps are actually rather closely based on a pair of instruments that were used on Samuel Pepys when he had a kidney stone. He had a stone, yeah, basically a stone developed inside of him, about the size of a tangerine. And he had to be opened, and these were used to maneuver it out. What you have here, that curvature, it actually will slip past things very easily. So I can get past that bullet, and then with a simple rotation, that's why I have a bit of a trigger on that. Lets you know what's going on inside.
And you know which way it's pointing.
And then out comes the bullet. But what's good about this, if you're dealing with soft tissues that you're trying to remove, including things like kidney stones and the like, this can be used to maneuver behind it, hold it steady, so when you go in, again, these jaws are slightly concave, so they'll grab hold of it. And you can grab something, I mean, this is about the size of what was pulled out of Pepys, and it'll hold it quite firmly. So this was what was going on inside of him, and out it came. A most painful procedure it was, because he was conscious through it, obviously. And interestingly enough, he then had this stone saved, and they would bring it out once a year on the anniversary of the operation and have a feast in its honor. And that's very true. But then other instruments we have, for example, now here you've got retractors. The problem with retractors, what they do is basically open a wound so you can work inside. The only problem is, of course, you need an assistant if you're working with this style of retractor. And if you have an assistant, that's fine. If you don't, and let's say we're trying to open a wound a little bit so that I can access the wound and again, perhaps get at a bullet. So let's say we have the bullet in the wound. If I'm working on my own, I might use forceps retractors, which with normal forceps, just grab the bullet forceps, when you pose your hand, they tighten. Here it goes the reverse. So this can go into the wound, gently hold the wound open, which will allow me to go in with the bullet forceps, grab hold of the bullet, pull it out, and then I've now got the wound cleaned out. Now, of course, once we've actually removed that
if you needed two hands, you could just strap it.
Well, potentially, but the problem again with strapping it is I'll have to just work on that two-handed, and then I go in if I need to, yeah. But this does allow me to do an operation on my own. Now, of course, when you're doing operations, you need to think about how you're going to handle the wounds. So a lot of wounds, for example, were dealt with in the earlier part of the century. In the 16th century, early 17th century, if you have, for example, a bleeding artery, this is a very bad problem, so you might well use a cauterizer. This particular one is used against arteries. And what this would do, you would heat that up till it was a glowing red, and when you touch that to the artery, it will cauterize it, feel it, and that's terrific, but actually the results for healing aren't as good as you necessarily want them to be. It's causing trauma. So, being in the latter part of the 17th century, I'm more inclined to use this instrument, which is a tenaculum. Now the tenaculum is essentially a small hook, and what I will do is I will take a silk thread, tie it into a loop, which I'll drape over the tenaculum, use this to hook the end of the artery, slide the ligature over the artery, pull that tight, and now that I've tied down the artery, it'll no longer bleed. And we find that it causes less trauma and wounds heal better. The survival rate has gone up since we started using the tenaculum. We'll still use cauterizing from time to time, if necessary. But actually, as the 17th century is closing, we're going into the 18th century, we're finding a few new techniques. One of my personal favorites, which was not available generally to surgeons or physicians in the early part of the 17th century, is this particular pair of forceps here. And only towards the end of the century do we have these. And these are wonderful, because these have lowered infant mortality dramatically, and these are obstetric forceps. So these will go past baby's head quite easily, grab hold, and very gently be used to guide the baby out in delivery. So if there's a troublesome delivery, this has significantly reduced the mortality rate and greatly increased the survival rate. So quite happy to have those. We have a range of other instruments. I mean, some things are more obvious than others. I mean, here, for example, are some of the tools we would use in an amputation. So the saw we would use to cut through the bone, but of course that can leave jagged ends. And those jagged ends could be uncomfortable for the patient for the rest of their life after the wound is healed. So we would use something like a bone file to smooth off the end of the bone, round it out a little bit. It makes it a lot more comfortable. Of course, before we even get to there, we have to start with cutting open the wrist. So when you're trying to cut open the wrist, you start off with a capital knife, which is a curve on it, and we would use a procedure going, I'm not actually going to cut myself open, but I'll just demonstrate here. You would just go all the way around. This will actually separate the flesh that you're keeping from that which you discarded. Then we might change over to more of the scalpel and slice the tissue in between the bones, because you have two bones in the arm. Once that's done, that's when we move on to the saw. Now, there are ways we can relieve some of the pain, but of course that's going to happen after the surgery. You wouldn't want to give your patient something like laudanum before the surgery. That's not going to end well, but something like laudanum you can give them after the surgery is over. Now, this is basically alcohol with opium dissolved into it. It's very good for easing the pain, numbing the senses, and helping the patient to sleep, which of course will aid in recovery. I mean, we have, again, a number of different things that we can use. One of the things we might want to do is, we're not going to start sewing up right away. We're going to let the wound heal a bit before we sew. So you would put perhaps something like honey and then a poultice on it and bandage it. And then by the time it's been left for about a day, we might clean that up. We can take the rose petals and make rose water from this. And while that's still fresh and hot, we would clean it off, because of course if you have any bad smells, you have the miasma, which of course is the cause of all the rotting. At least in the 17th century we think so. So we want to get rid of that rotting by cleaning it up with the rose water. We'll get rid of any decayed tissue, but at the same time we'll also make it smell pleasant. So we've removed the miasma and now it's more likely to heal. In fact, they discovered that treating with rose water did in fact improve the outcomes. Now of course the reason for this is if you're making fresh rose water, you're going to start with boiling water. Make it like a tea. And when it cools down to the point where it's still hot, but not so hot that the patient can't handle it,